Psychological disorders. So, what was formerly known as mental illness or mental disorder is now often referred to as psychopathology. So, some feel mental illness puts the basis for the illness on biology, even though psychologists have shown that environment is often the cause of the disorder. Right? So, we talked about nature and nurture, and it's a little combination of both. And a lot of times we used to think it was all nature, but we're realizing now your environment has a lot to do with it as well. So psychopathology is any pattern of emotions, behavior, or thoughts inappropriate to the situation and leading to personal distress or the inability to achieve important goals. In America, mental illness is far more common than people realize. Over 15% of the population suffers from diagnosable mental health problems. Another study found that during any given year, the behaviors of over 56 million Americans meet the criteria for a diagnosable psychological disorder. And that was in 96, so the number is a lot higher now. So worldwide, 450 million people suffer from the mental or behavioral disorders. And that was from the World Health Organization. And that was 2010. So over the lifespan, as many as 46.4% of Americans suffer from some psychological disorder, according to Kessler et al. And that was 2005. So as you can see, a lot of times people don't realize how prevalent it actually is. But just because you had a mental disorder or illness doesn't mean it's lasted with you your whole lifetime either. So sometimes someone might only have it for a year or two, especially when we talk about like depression. And this can definitely increase depending on the situation around you. Like, so if there's a pandemic going on, maybe certain illnesses would increase. So how do we discern, what is normal and abnormal? Like, so consider eccentric personalities like a Robin Williams, a Dave Chappelle, Madonna, Marilyn Manson, right? Are they crazy, or is that just their personality? Is that normal? I mean, we watch them on TV, we laugh at them, So how do we discern what's normal, what's abnormal? So it's not easy, right? There's a lot of gray area there. So think about a soldier who risks his life in war, but then comes back and has PTSD. They were originally fine, but then they experienced something traumatic. So do we just kind of throw them in? Oh, you just have a mental illness. So we seem to forget about a lot of the environmental issues that play a part in it. Think about a grief-stricken mother who can't return to her normal routines 3 months after losing her son. So when does it, become depression and not just sadness? How long are you allowed to mourn before it becomes depression? So these are very subjective answers that we have to these problems. The three classical symptoms of severe mental illness. So the more extreme a disorder is, the more easily it is to detect. When trying to diagnose a patient, doctors look for three classical symptoms of severe psychopathology. And so the more of these different, classical symptoms you have and the more severe they are, the easier it is to diagnose. A lot of times, mental illness can be very hard to diagnose, especially if it's not severe, because there's all this gray area about what's normal, what's abnormal. So the three symptoms: hallucinations. These are false sensory experiences. So this is like hearing things that aren't really there, seeing people who aren't really there. Delusions. Extreme disorders that involve persistent false beliefs. So a lot of people get hallucinations and delusions mixed up. Hallucinations is just like seeing and hearing things that aren't there. Delusions is thinking something actually happened that didn't happen. Like thinking that you were dating like this famous person and it never happened, right? That's a delusion. Affect. Affect, we're talking about emotions. So characteristically depressed, anxious, manic, which is like an extreme high, or no emotional response at all. So we're going to see with the different disorders that some have no emotional response at all, like antisocial personality disorders. So those are like the sociopaths, like serial killers who kill and then they feel no remorse for it at all. So here's a little chart where you can kind of see what we're talking about with with disorders. So if you have no disorder, we're talking about, absence of signs of psychological disorder, absence of behavioral problems, no problems with interpersonal relationships, right? Interacting with people. If you have a mild disorder, so you might show a few signs of distress, other indicators of psychological disorder, maybe a few behavioral problems, response is usually appropriate to the situation though. A few difficulties with relationships. If you have a moderate disorder, indicators of disorder are more pronounced and occur more frequently. More distinct behaviors often inappropriate to the situation. More frequent difficulties with relationships. Severe disorders. Clear signs of psychological disorder which dominate the person's life. All right, so some of the other ones, you might be able to live a somewhat normal life, but with severe, this dominates your life. Severe and frequent behavioral problems. Behavior is usually inappropriate to the situation. Many poor relationships or lack of relationships. So two contrasting views on mental disorders, right? So as with most topics in psychology, there are multiple perspectives on psychological disorders. So we have the medical model, right? This takes a disease view. Psychology, on the other hand, sees psychological disorders as an interaction of biological, mental, social, and behavioral factors. So, but first we need to talk a little bit about the history of psychology or psychological disorders and kind of the treatments that go along with them. So in the ancient world, psychopathology was thought to be caused by demons and spirits that had taken possession of the person's mind and body. So part of daily life in ancient worlds was spent doing rituals aimed at outwitting or placating these supernatural beings. So if you think about it, a long time ago, hundreds, thousands of years ago, you know, there's a lot of things that they didn't understand in the world. So they always had to come up with reasons why things were happening. So if someone had a mental illness, a lot of times it was because they were possessed, right? A demon had something along those natures, some kind of supernatural thing, right? We always see this when we talk about, ancient times and their explanations. And this goes into the religion, right? A lot of the religion was based off explaining, what they couldn't explain. And same thing with this. So in 400 BC, the Greek physician Hippocrates took the first step toward a scientific view of mental illness when he said that abnormal behavior had physical causes. He taught his disciples to interpret the symptoms of psychopathology as an imbalance among our body fluids called humors. And so he was on the right track, but obviously, as you can look at the humors and the origins and what happens from it, he wasn't exactly accurate. But, that was a very important first step. And he realized that it wasn't just, oh, you're possessed by something. Now, unfortunately, after the ancient Greeks and Romans, we went through a dark ages where, well, especially Europe was not very educated, and they went back to more of that supernatural view. But very few people were educated then, but even the educated people did believe in these, kind of like in these humors. But they weren't, so like their treatment would be to like bloodlet, right? Cut you, let you bleed, and let the humors be released. Or maybe drill a hole in your head to let the humors be released. All right, so as you can see here, you had the blood humor, which comes from the heart, deals with being cheerful. The choler, which is the yellow bile, comes from the liver, and that, deals with being angry. So you see the temperaments in that right box, which you guys know what temperaments are, those biological predispositions we talked about. Melancholy, that's the black bile from your spleen, and that deals with depression. And phlegm from the brain, and that deals with like you being sluggish. So regression in thought. So like I just mentioned, in the Middle Ages, superstition eclipsed the Hippocratic model. So under the influence of medieval church, physicians and clergy reverted to the old ways of explaining abnormal behavior. And we see this even like up through like the Salem witch trials and just a few hundred years ago, where you see people blaming things because they didn't know what the answers were. So as a result of erroneous thinking, thousands of mentally disturbed people were actually executed. Right? They're like, "Oh, you're possessed," and so they would actually execute them. So in Salem, Massachusetts, was one example of the problems with this type of thinking. So a modern analysis of the Salem witch trials has concluded that the girls were probably suffering from poisoning by a fungus growing on rye grain, the same fungus that produces the hallucinogenic drug LSD. So you had these people, and some of them actually thought they were witches because they were tripping, right? They were hallucinating on, well, essentially what LSD is made of. And of course, then it goes farther where you have some people being accused of witch, and then other people see, hey, I want your land, I want your husband, I want your cow. So they accuse them of being witches, and so you had a lot of innocent people that were accused of being witches as well. And one of the ways they tested to see if they were guilty or not is they would drown them. And they'd be like, oh, if they're really a witch, they'd be able to get out, like they would tie them up, and they'd really be able to get out and survive if they were a witch. As you can imagine, most people did not survive this. Though I have read one story of a woman who actually did survive it, and she was able to live her life afterwards. So the medical model. So in the late 18th century, the disease view reemerged again. The result was the medical model, a view that mental disorders are diseases of the mind that, like ordinary physical diseases, have objective causes and require specific treatment. Right? So this is a lot better than just saying you're possessed and let's lock you away somewhere. And if you look at some of the devices, they literally strapped them up. So if you think about like an insane asylum, like some of those like horror movies and those contraptions they had there, that's what they put them in. So they weren't getting any better. But this approach was obviously a step in the right direction because if there's a disease, then there could be a cure. So the medical model and practice. So the medical model led to mental hospitals or asylums. So in this supportive atmosphere, many patients actually improved, even thrived on rest, contemplation, and simple but useful work. So some of the early ones, sometimes weren't very good, were kind of like prisons. But as the years went on, they got better and they actually let them get like fresh air. And surprisingly, people got better, right? If you don't have people locked away in a dungeon and you actually try to, do something positive and give them, a little freedom, fresh air, a lot of positive can happen. And there were a lot of reformers around the world. The one person you should know for the U.S., though, was Dorothea Dix, D-I-X. She was one of the main reformers in the United States for, improving mental hospitals and making it more humane. A lot of you guys might have heard of her in your U.S. history class. So the medical model was an improvement, but there are some problems with it. So despite its success, modern psychologists find fault with relying solely on the medical model. They suggest that treating the disorder as a disease leads to a doctor knows best approach in which the therapist takes all the responsibility for diagnosing and correcting the problem. So in this model, the patient becomes a passive recipient of medication and advice. So even like that's a very Freudian way as well, even though that's not the medical model, right? In the modern way, you're going to see is the patient needs to take ownership, right? And we see this in a lot of things in life, not just like this, but even think about teaching and learning as a student. The more ownership you take in, your studies, the better you're going to do. The more ownership you take in work, the better you're going to do at your work. So, I mean, we see this with everything, and this includes like therapy and mental disorders and treatments. So psychologists versus psychiatrists. So we've talked about this a little bit before, so hopefully you remember this. The other problem psychologists have with the medical model, the doctors know best, is that it takes responsibility away from psychologists and gives it to psychiatrists. So if you remember, psychiatrists are the only ones who can prescribe medicine because they have a medical degree. Now, some states have changed this where clinical psychologists can prescribe medicine, but they have to go through a very rigorous program to be able to do this. All right, so according to the authors of the textbook, it assigns psychologists to second-class professional status because well, just because you can't prescribe medicine, they don't think they're as good as psychiatrists. And that's obviously not true. Medication should be a last option, not the first option. So sometimes psychiatrists actually get a bad rap because they're seen as maybe just like pill pushers, right? They don't look to actually correct the problem. They just fix it, do the quick fix with medication. And I'm not saying medication is bad. It is needed in a lot of circumstances, but the goal is to get off medication, and that doesn't always happen with psychiatrists. So sometimes they get a bad rap because of that. The social cognitive behavioral approach. So as psychology has evolved, theories which were originally at odds have now been combined to offer a more thorough explanation. For example, the cognitive psychology and behaviorism. So cognitive psychology looks inward, emphasizing mental processes, where behaviorism looks outward and emphasizes the influence of the environment. As you guys should know, because of the different perspectives we've talked about this year. So psychologists from these perspectives see these two as complementary and add that cognitions and behavior usually happen in social context, requiring social perspective. All right, so it's how you think and behave. It's not just one or the other, but it's a combination of both. And so we look nowadays to try to correct both. And they kind of go with each other. If you think a certain way, then you're going to act better, right? If you act better, you're going to think better. So combining the perspectives. Last slide. The behavioral perspective tells us that abnormal behaviors can be acquired in the same fashion as healthy behaviors through behavioral learning. So if you can learn to misbehave, therefore you can learn to behave in a more socially normal way. The cognitive perspective suggests that we must consider how people think about themselves and their relations with other people. Therefore, the social cognitive behavioral approach, right, so the more modern approach that we use, then is an alternative to the medical model combining all three of psychology's major perspectives.